Well, as our population ages, I think it's very natural for folks to want to stay in their own homes, if at all possible, as they get older, and enjoy the latter years in a comfortable environment that they work so hard to build in the first place. Now, to help us do that, joining us this morning, Suzie Reichel and her mother, Lorraine Salerno. Now, Suzie, you're the CEO of Advanced Home Health Services, right?
Yes, that's correct.
And this is a home care service?
Yes. Mm-hmm.
And Lorraine, you started the first home health care service in San Diego, or in Southern California, perhaps.
Yes.
How long ago was that?
That was 1978?
1978.
Yeah, 1978.
So what made you decide to fill that niche in the first place? There wasn't a niche at that point. There wasn't anything like it.
And we had a beautiful doctor, Herb McCoy. He said, Lorraine, I think we need a registry here for the elderly. So he said, and I would like to go in with you. So he called back and he said, it's a conflict of interest and I can't do it with you, but I'll help you all I can. So my partner at that time was Nadine Roby, and we forged ahead. And our first week, we each received $400 clear. We cleared $400.
That's great.
And God was so good, we just kept flourishing and growing inch by inch. I had all the hospitals, I had all the facilities. They all called Lorraine.
Well, and now they're all calling Suzie
Yes.
as well, because you've decided to carry on.
That's correct.
What made you, were you just watching what Mom was doing and saying, hey, that's a noble profession? Or what?
Not exactly.
Okay.
No, I was actually working with Mom. So I started when I was 17. And so I continued. I worked as a caregiver. I worked in many, many facilities. And then I just decided, I saw that there was still such a great need to be able to help seniors be able to stay at home. And so I continued, and it's just grown and grown. And we have, probably over 100 caregivers all about San Diego, helping seniors stay in their home.
Well, as I was telling you, I've got a mother and a stepfather and my father, both, all three here in San Diego. All three have said, absolutely, we want to stay in our homes.
Right.
That is our, and when people work their whole lives so hard, they deserve to be able to stay in their homes.
No question. Mm-hmm.
But I guess maybe one of the first questions that people have, though, is, first off, how do I go about selecting an organization that could do this for me? You're welcoming people into your home,
right?
And the people that you're caring for are very vulnerable.
Absolutely.
So how do you pick the right organization first off?
Right. Well, you want to make sure they're a screen, they have all of their employees are screened, bonded, and insured, that they're not independent contractors, that they're, coming from a reputable agency. That's really important because I think there are so many new ones today. And certainly it just needs to be someone that, is known in the community, that has a very good referral list. You can ask also word of mouth. And you might also even check their, what their background checks are, how they're screening these people. I have never once taken anyone, other than by word of mouth. So I've never gotten anyone out of the newspaper or anything like that.
They have to be referred to you if they're going to come work for you.
Absolutely. It's a very specific, absolutely. They must be.
And then, again, Lorraine, this probably makes a lot of sense just from an economic standpoint and a healthcare standpoint. Isn't it more cost-effective sometimes for people to stay in their own home?
I think so, yes, and they're happy. That's the important thing, that they're so happy and secure to be at home.
Now, you do have to pay for this service, though. I mean, it's it's not free, obviously.
Right. I wish I could tell you I could bill the government, but I can't.
Exactly. So that you can't bill the government for this. This is something that people have to kind of look towards and plan for.
Right.
Now, my parents have bought long-term health care.
Excellent.
Yes. That does take care of it?
Absolutely, it will. So any kind of long-term care insurance certainly will. People are under the assumption that Medicare will somehow pay for this, and it just will not. This is something that is either privately paid. There can be VA benefits if they're military. Certainly we help, every avenue we possibly can. But long-term care insurance, or it's privately paid.
But you also have a wide variety of plans. If somebody doesn't need a live-in home health care, they might just need a visit once a day or maybe 3 times a week or something like that. So you work with all types of needs in that regard. And now you have an offer here that I think you want to make as well.
Okay.
That this has to do with, I think we can put it up here on the screen. It's 8 hours free if you just mention San Diego Living. 8 hours of home health care for free, but you do have to mention San Diego Living.
That's right. You can't beat that.
Okay, yeah, you really can't beat that. So please talk to Suzie. And Lorraine, are you retired?
I'm retired.
Okay.
Thank you, God.
Is Suzie taking good care of you now?
Very. I've got the best care.
And there's the best testimonial you can get right there. It's great to have you both here. Advanced Home Health Services. Suzie Reichel, thank you so much. Lorraine Salerno. Thank you for getting the ball rolling so many years ago.
You're welcome.
Thank you.
All right. For more information, you go to san diego6.com and you just click on San Diego Living. Pretty